So you spent the whole week trying to do PCOS right. You've been keeping carbs low. You've been quote unquote eating clean, right? And doing everything you can to manage your blood sugars. But 4 p.m. hits or 9 p.m. hits routinely, and then you're wired and there's this like primal urgent hunger that doesn't shut off. And then eventually you find yourself like at the bottom of cereal bag, chip bag, crackers, right? Anything quick. It's out of control. You don't even know what happened. And then it's over. Right. And then maybe you feel a little bloated, exhausted, and ashamed and thinking it's a willpower problem. So if the scenario, what I just described to you, is actually binge eating, right? If it feels familiar, then you are in the right place. So today we are talking all about the connection between PCOS and binge eating. And I just want to clarify right off the bat, binge eating isn't tied to like a volume of food. You don't need to hit, a minimum criteria to be considered someone who engages in this behavior. It just means a loss of control. And it's also common and normalized, right? My point here is not to instill shame or feel like you have to avoid it altogether, right? But we're going to talk about the who, what, when, or why of binge eating if you have PCOS and what we can do to manage it. So for those who haven't met yet, so welcome back to Joyful Eating for PCOS and Gut Health, where we take away the guesswork, the confusion, and shame about your hormone health and really replace that with a lot of clarity, a lot of context, and support that meets you where you're at and actually makes sense for your body. So I'm Trista Chan. I am a registered dietitian and the founder of Nest and Nurture. We are a virtual cross-Canada PCOS health clinic that provides nutrition, therapy, and nurse practitioner support to better your hormone function. So twice a month, we actually release episodes on this podcast. Expect to learn a lot of deep dive into different hormonal conditions, right? And also practical tools to support your health. So I always like to start off with a little bit of an update here at Nest and Nurture because it's been a while, I think, since I've done one of these, and we're almost like halfway into the year, which is wild when I think about how quickly the time has flown by. Honestly, it feels like we haven't even gone that far because it's been so cold here in Canada that I think we've just started getting some sunshine. So spring right now, we've had a really, really long winter, and for those who might be following along, we actually did a huge rebrand in January. Previously, we were the Good Life Dietitian. Now we are Nest and Nurture. And with that, we had launched service expansions, right? So like I said, now we have a nurse practitioner to provide diagnostic medical care, as it is what we hear time and time again, like harder and harder or very hard for people to access. And then we also have mental health services. I truly believe, especially with PCOS, you really need both. Right? There's that nutrition support, and then someone who is also a qualified mental health clinician. And the reason why I actually decided to do this was that I was working in a solo one-on-one private practice as a dietitian for years. And throughout that, I kept seeing the same trend come up time and time again, right? And that people with PCOS needed more well-rounded care. And then most of my patients were navigating multiple providers, different clinics. I was faxing this person, faxing that person. I was their dietitian. They had a different physician. They had a therapist somewhere else, right? So it was super fragmented, the care and the recommendations. And even though we did our best to collaborate, it didn't feel truly connected, and it put a lot of burden on the patient, to actually put those puzzle pieces together and get everyone aligned, right? So while I still really value and actively partner with like external healthcare systems, I started asking myself, why not bring it together in one place under the roof, right? And I've always said this, like nutrition is not the be all end all, even as a dietitian. Like personally, I have never, ever resonated with the quote, food is medicine. It's not. Food is not medicine, right? It's not enough to address actual diseases, right? And help with disease management. It can absolutely help reduce the risk, help with prevention, help with prognosis, right? Help you live long, full lives. It's not also going to fix quote unquote mental health conditions and disorders as well, right? And it's really not sufficient on its own, especially to treat complex conditions like PCOS. We also have a focus on endometriosis and metabolic conditions, diabetes, and And there's psychological, dermatological, there's reproductive features, right? So that's why our model now integrates, yes, there's dietetics. It's dietitian led. This clinic still huge nutrition focus. Every single patient that walks through our doors works with a dietitian because I really believe there's so much power to improve the health across the board with medical nutrition therapy for PCOS and hormone conditions. But now we also have a nurse practitioner, like I said, for medical management and mental health clinician for supporting, emotional patterns, stress, and underlying mental health condition concerns as well. So all that to say is welcome if you are new. And if you are a repeat listener or follower or a client or a community member or a patient or a partner, thank you so much for supporting us. And I hope you find a lot of value in today's episode, which is about binge eating. And throughout our years of practice, throughout the thousands of clients who have come through our doors, whether it's one-on-one clients, most people, I would say, a large majority of our patients struggle with binge eating, right? So like I said, that loss of control around food, not tied to a food volume, but it's super complex. It's super multifactorial. And so many people with PCOS quietly suffer with this. And there's a lot of shame around it too, right? And we see this all the time on our one-on-one sessions, our PCOS recovery program, literally like in our DMs, right? People are saying, I literally can't stop binge eating. What do I do about it? And the pattern is very much similar across the board. Maybe there's a little bit of restrict, whether that's unintentional. I'll talk about why you restrict or intentional. Maybe that leads to a blood sugar and insulin crash, right? That loss of control, that binge eating, and then maybe there's a shame spiral, a lot of negative self-talk, and then rinse and repeat that cycle. And it's really, really hard to get out of that momentum. So that is what we're addressing today. I really want to dismantle the shame and give you a full picture about, of why this is happening and what you can do about it. Right? So we're going to talk about blood sugar instability, how it triggers binges, why PCOS specific hunger cues may be a little different, right? And what to do about it and when to loop in additional support. Okay. So first and foremost, let's talk about the biology with PCOS, with blood sugars, insulin, and how that relates to the urge to binge. So what is happening, right? So what feels like this secret eating issue is often a physiological response to an overwhelmed system with PCOS. And once you understand that, we're focusing that shift from control to stability, right? So with PCOS, over 70% of people, regardless of body size, can have insulin resistance. And this is when your cells aren't responding to insulin properly, which helps convert sugar into your bloodstream, right, into your muscles so it's used as energy. But since it's not responding properly to this mechanism, your body then pumps out more insulin, right? And more insulin, more and more that's in your bloodstream, blood sugars stay high, and this leads to more fat storage, especially in the abdomen. Increase of hunger, because your muscles aren't actually getting that energy, so it's hungry, right? More cravings, and you are more prone to blood sugar crashes if we're not taking steps to mitigate it. So what actually happens when your blood sugar crashes, it's very, very visceral, right? So cortisol, the stress hormone, can increase to actually compensate. It can cause your, ghrelin, your hunger hormone to increase, right? That prefrontal cortex, so that decision-making part of your brain that's rational can go offline. That's why it feels like you're not even yourself sometimes when your blood sugar crashes and you're like hangry, you're shaking, you need sugar right away, right? Like it's so hard to make rational decisions there. Never make a rational decision there, and never pick a fight with anyone either, right? I'm definitely one prone to get hangry there. And your body is not asking you to eat. It feels like it's telling you to eat, right? Like there's a huge, huge difference there. And that's where that binging begins, right? And afterwards, if we've eaten a large amount of food, maybe our blood sugars then spike, and then that momentum of that low, high, low, high, low, high, that roller coaster of our blood sugars, then fuels that insulin resistance. And this is where I want to lead to, like, that's kind of what's happening below the surface biologically, right? Physiologically. But sometimes that intersects and meets with our habits and our behaviors. And it can be compounded by unstructured eating and unstructured timing. So let me explain what this means, right? So if you're someone with PCOS who struggles with this, and also you start off maybe skipping breakfast because you weren't hungry in the morning, right? Or maybe you're commuting, or maybe you're making breakfast for your kids and you're super busy, or maybe you have to go to class and you're just grabbing a coffee. You have 8:30 class, which is criminal, I know. Maybe then lunchtime comes and you're eating like a really, really light meal and you're like, hey, I'm just going to grab something late or grab something on the go. It's not necessarily complete. Or maybe you're just not hungry throughout the day because maybe you're taking a medication that kills your appetite. Maybe there's neurodivergence, right? And sensory challenges, right? Whatever the reason is, if we're not necessarily eating adequate protein, fiber, and fat in a structured timing throughout the day, right? And spreading it out across the day, by the time mid-afternoon comes, evening comes, also it's natural to feel a little bit more tired, just the way our circadian rhythms work along the way. But by the time those times come, your body's likely underfueled, your blood sugars are likely low. There's that crash, right? You're tired and you're wired, you're hangry, and that food noise that might already be there is just intensified like no other, right? And if this is the scenario, like no amount of mindful eating techniques. I know it's all the rage, and I actually am a huge believer and practicer of mindful eating, but no amount of that technique is going to help address the binge eating, right? In this specific context, it is useless because it can't outthink our body's needs for survival, right? So you have that underlying insulin resistance, and then as compounded by like maybe we're just not eating structured or we're not eating enough throughout the day, and that creates that perfect storm where suddenly food's in front of you, you're thinking, you can't stop thinking about it, you're jittery, right? And you eat a ton at once and then you feel bloated, blood sugar's high, and then it crashes again. Maybe then it leads to, your sleep isn't the greatest, you're tossing, you're turning at night, your digestion isn't the greatest either, right? Because it's overwhelmed and overloaded by that large bolus, that large volume of food. And then our cortisol levels kind of stay high, right? So if this is the cycle, right, know that that is okay. It is something that can be supported and changed. So by stabilizing those two like upstream drivers, the insulin, the cortisol, through consistent nourishment, eating a balanced breakfast, checking in every 4 hours, is it time to fuel, right? Stabilizing your blood sugars through that meal timing, but practicing stress regulation, right? That can help you break free of that cycle. And then when that's done, it's kind of like a waterfall effect. Everything downstream can just flow a little bit more smoothly, right? And that includes what you're feeling. Yes, the craving, the energy, the mood, digestion, right? That can also help, is associated what I see in practice in regulating cycles, because you're likely also more likely to then also eat more nourishing meals, right? That's going to help replenish your micronutrient stores, help tell your body it's safe to ovulate, right? But that also usually has that downstream effect where it is also going to support estrogen levels, progesterone levels, androgen production as well. Okay, so that's kind of the first piece, right, to consider. But the factor, there is that connection between PCOS and binge eating, and there is that biological factor, right? What's happening with our blood sugars and our insulin levels. Okay, so number two, right? What is that second factor that impacts binge eating in PCOS? And that is our appetite, our hunger cues, right? Our hunger hormones, our appetite hormones. I just literally said the same thing in like 5 different phrases, but you know the gist of what I mean. And the potential neurodivergence layer. So what is super cool about appetite is that there are so many factors that impact how much you need to eat to feel satiated and full. We covered one of them. It's the meal timing, the structure, right? But research suggests that people with PCOS may have different internal factors like varying appetite regulating hormones. For example, leptin, that's your full signal, your fullness hormone. It may not land the same way if you have PCOS, and it might not look the same in PCOS as it does to the next person next to you with PCOS, right? So that's why maybe you can eat a full meal and feel satisfied or not feel satisfied and full. And then the person next to you might feel like something's missing or it's not, right? It's totally not in your head as well. Now, with PCOS, oftentimes it comes with higher androgen levels. We know that more testosterone is associated with stronger hunger signals and more reward driven eating too. And then with PCOS, we know there's the psychological features, right? And there's that chronic low grade inflammation, and that can really drive someone to seek comfort through food. And whenever I say comfort eating, it's not a bad thing. Food is inherently emotional, right? It is one tool in the toolbox that oftentimes can be accessible for someone to grab if they need to regulate their emotions through food. That said, do we want it to be the only coping mechanism? No, probably not. So living with PCOS is tough. There's the unpredictable cycles, there's the insulin resistance, there's having fragmented care. We're working to change that. There's the frustrating symptoms, feeling like your body's working against you. And then, yes, food becomes a coping tool sometimes, and that's human too, right? So there is that factor as well. So one cool thing too, when it comes to appetites, eating behaviors, PCOS, is that an area that's getting a lot more research and awareness is actually neurodivergence. Research shows that ADHD is significantly more common in people with PCOS, and it's not a coincidence. The theory is that it's likely the shared neurological and hormonal mechanisms at play, right? And having ADHD can absolutely play a huge driver and a role here in binge eating. So it can impact your interoception. Like we said, that ability to notice your hunger cues and fullness cues in real time, right? So that cycle that I talked about where you're prone to the underfueling, the binge eating, furthering the insulin resistance, like that can be built into that. You are more prone to that with ADHD. There could also be that factor of impulse regulation. So that pause between the urge, right? That trigger, the urge, and the action, which is eating, can be shorter, right? There can also be dopamine-driven eating, right? So food becomes a really, really accessible, really fast, really reliable if you have access to food, dopamine hit if your brain is understimulated. Right. So there is a subsection of people with PCOS who also now have to manage ADHD and how that presents in their bodies. It impacts their binge eating behaviors. Right. So that is something else to consider as well. This whole cycle of the blood sugar, the binge eating can feel way, way, way more intense. And that totally makes sense. And it might feel like you might have to work a little harder than anyone else, right? And if you feel that way, this might be part of that answer. So it's really important to work with a provider who acknowledges this, who is understanding of this, and who can work alongside with someone with both ADHD and PCOS to find unique strategies to support them and works with them and their brain too. So lastly, what eating patterns actually support steadier appetite regulation, right? So to recap, what to do about this now, right? We know there's the underlying biology. We know there may be different appetite cues. They may or may not be neurodivergence at play as well. So what do we do to actually support, right? And reduce the risk of binge eating, right? Eat enough and early enough. Like I said, under eating in the first half of the day is truly one of the biggest predictors of that out of control, dysregulated eating at night. So I always strongly recommend building a system in your morning where you are eating breakfast. I usually say ideally within 2 hours of wake, right? Not as a hard, fast rule, but we don't want to get into a scenario where we're having coffee and a latte and then that's it, right? Because that's going to help set your blood sugar up for the day. It is going to help reduce your urge for sweets and that out of control eating all the way until evening, right? And research does show it is associated with better glycemic control, so blood sugar control, thus insulin sensitivity, right? All the way until evening, right? And think of it as just like filling your gas tank before a long drive. I'm sure you have a long loaded day. Even if you're like sedentary, quote unquote, on a desk job, I'm sure you have a ton going on in the day. It's a lot to function in this day and age in capitalism. So you don't want to be running on empty. 2, at each meal, think PFF, protein, fat, fiber. PFF is your BFF, okay? This combo is going to slow glucose absorption. It's going to keep your insulin response much steadier. It's going to prolong the fullness, the satiety rate. And it's so important because all of these nutrients, if we're eating a variety within this framework, It's going to give you a ton of protein for muscle maintenance, for blood sugar control, for satiety, a ton of fiber. That is so, so important because that's going to help support a diversified gut microbiome, slow digestion. It's going to reduce the risk of elevated cholesterol. And we know that's a long-term risk factor with PCOS. This is all relevant to your metabolic health as well. And then the fat is going to help you absorb all those wonderful micronutrients that you're eating, right? And is associated with better heart health and is a protective against heart disease. Okay. Unsaturated fats, I should clarify. Right. 3 is meal spacing then. So you're having a breakfast. At each meal, we're doing protein, fiber, and fat. And now we're trying to space 3 to 5 hours as a general guideline between meals rather than maybe we're snacking, we're grazing throughout every day, we're grazing every hour, we're grabbing another snack, maybe we want to distract ourselves between meetings, right? Let's set some structure, set some boundaries. We also don't want to get at the end of the extreme where we're going long stretches, 6, 7 hours without eating, right? So we want to actually give time between meals for our insulin levels to lower, stabilize, but also not so much time that our blood sugars crash too. So usually the sweet spot I say is about 3 to 5 hours. Check in, right? And this might change throughout the month as well. And if you feel that urge to binge, don't white knuckle it. The more we resist, the more it persists, right? Don't just try to shove it down in shame. Like, name it. It's okay, right? It's not a bad thing. We don't have to attach morality or value to it. Just, okay, I'm feeling this urge. Maybe ask myself, why? When was the last time I had something to eat? Maybe we're starting with a little bit of protein first, right? We're having that action first. Maybe we have some hard-boiled eggs, some, a glass of milk, right? Maybe we have like some Greek yogurt. And they're saying, okay, is that urge still there? Is it still present, right? Oh, and add some of the fiber, of course, to those foods, right? With some fruit, maybe. Maybe you're doing cottage cheese on toast, right? And then is this urge still present? If so, is it a specific emotion or feeling I'm trying to numb, right? Is it a sensory, a dopamine hit I'm trying to? Is there other ways and tools in my toolbox that's going to fulfill these needs beyond only relying on food? And if you do decide to eat, it's going to feel a lot more intentional than having that automatic response, right? So lastly, I want to end off just talking a little bit about, okay, these are all nutrition strategies. When is it important to loop in medical care and a therapist? Like I said, like nutrition is not by any means the be all end all. No food is medicine. Food is a really powerful promoter of health. It is essential for survival, for well-being, to help you thrive, but it is not medicine, right? And it is not mental health care either, even though it absolutely plays a huge role in how your brain functions. All right. So if you're eating well, balanced, quote unquote, right, and you've made these nutrition changes and you feel like, okay, like you need a little bit extra support, right? Maybe there are underlying feelings around body image, around specific traumas that you want to work through, right? And that's where working with a therapist who understands you and mental health can actually support that area. So now let's talk a little bit about when to loop in medical care and a therapist as a dietitian and as a dietitian-led clinic. Right, of course, I focus a lot about nutrition. But like I said, food isn't the be-all, end-all, right? Absolutely, it is so powerful to like manage conditions, to improve your quality of life, your lifespan. But, when symptoms become persistent, if they're distressing, if they're affecting your quality of life, truly, or they're really medically complex, that's usually a sign that more than just nutrition needs to be considered, right? So I'm a huge believer in integrating lifestyle with medical care. I'm going to talk a little bit about therapy first, because for many people with PCOS, there are often psychological layers alongside the physiological ones, right? So this could be eating disorders, which we know there's a higher prevalence of, anxiety, depression, maybe there's underlying trauma that can really shape your eating behaviors, your stress responses, and also how your body regulates hormones as well. And this is where therapy becomes a really important part of your care, not just as an add-on, but as a core piece of your treatment plan, right? At the same time, if you don't have medical support, maybe you were diagnosed and sent on your way, or you actually don't have any answers, maybe you're listening and you've not been diagnosed with PCOS or any other condition, but you feel like symptomatically something is wrong. Your hair is falling out, you're craving, you have sleep, you have poor issues, insomnia, right? Your period's all messed up, right? That's where medical support, whether it's through your family physician, a referral, or through our nurse practitioner, can help assess the physiological sides, right? So lab work, very thorough, diagnostics, medications when appropriate. Um, so really that real progress requires that multi-angle approach, right? So there's that psychological, nutritional, there's the behavioral, and also the medical as well. And that's exactly why we pivoted and really built Nest and Nurture the way we did, with the dietitians, with the therapists, and the nurse practitioners working together for integrated, connected care, right? So this just means that nothing falls through the cracks and nothing gets missed in your care. Okay. So thanks everyone for tuning along, right? What you've been experiencing, just to recap, if you have PCOS and binge eating cycles, it's not a willpower problem. It's not a character flaw. There is that underlying physiological pressure, whether it's biological, whether it's emotional, right? And it's so tough just navigating the PCOS, insulin resistance, the lack of answers, right? And just like your body is truly doing its best to keep you safe. So one thing to try this week: eat breakfast with protein and fiber. Check in every 3 to 5 hours. Slow down if you feel that urge. Try a little bit of protein and fiber first to binge. And then if you still feel that urge, you can either decide to choose to eat, but it might feel a little bit more regulated as you slow down, or ask yourself, what am I really feeling? What am I needing? Are there other coping tools I can put in my toolbox? And if you need additional therapy support or diagnostic medication management, thorough lab work through our nurse practitioner, then you can hit the link through our clinic to make an appointment. We are available across Canada, and we do offer direct billing for dietitian work if you are looking to integrate one-on-one nutrition counseling to help you build better habits for your PCOS and also find a more peaceful relationship with food. I'm also going to be linking that below. Thanks so much, everyone. We'll chat soon.